what are the newest developments in your field, in knees and hips?
You know, the new things you'll hear about that, you know, if you'll hear on the news and in advertisements, the new implants that are coming out that are different materials or different designs. I usually never tell a patient, go to this surgeon because they're using this particular implant or this particular part. I pretty much say, go to the surgeon that has a good brain in two hands. But there are knees out there that are specifically designed for women. You know, my take on those women or female replacement parts are, they generally come in a pink box, and when we take them out of the box, they just look like a regular knee.
So that's more of a marketing tool?
So they're more marketing tools. There's a brand new knee that came out that maintains your anterior cruciate ligament. Mm-hmm. There's not a knee on the planet that does that. So it's new, and it's a kind of an experimental type knee that's FDA approved that I can put them in. And I've done them. I actually just saw one today that said, this knee feels like my natural normal knee. You know, she did very, very well. But this is still a new type of knee, a little bit different design, that the one thing you can never tell a patient is, I've done these knees and I've seen them out for 10 and 15 and 20 and 30 years. So these new things that come out may turn out to be bad things in 5 years from now and get pulled off the market. Mm-hmm. So just because it's new doesn't mean it's the best product for you. You know, a good example of that is there was a metal on metal hip implant that the metal on metal was, we thought 10 years ago, was the best surface for hip forever. It will never wear out. It was supposed to be the fix-all hip that one time you fix it and you're good for the next 100 years. Mm-hmm. And it turned out that a significant recall of that hip came out, and a lot of those parts loosened very, very early within the first 6 months. One company had a 50% revision rate within 6 months. So this perfect hip that was getting very, very popular, every single surgeon was putting those hips in young patients. Mm. Now you won't find one surgeon in the country putting in metal on metal hips.
And briefly, you're not a fan of the robotic component of joint replacement?
Again, those are different ways to put the parts in there. They're very gimmicky. I think the surgeons that use them don't do high volumes, and they kind of need these extra tools to help market their practices. But it's definitely not a better way to put the parts in there. It's a very, you know, the particular robotic knee, it has actually a very, very accurate way to measure where an implant should go. Mm-hmm. The way they put it in, it's very accurately measured, and it's very crudely put in with a kind of a dental burr. I was an engineer, and the classic measure with a caliper and cut with an axe is that particular robotic knee. If you're a good surgeon and you do a high volume of these, the standard instrumentation we use, I think, does a very, very good job, better than any of these newer things that come out, whether they're custom knee replacements, whether they're robotic knee replacements, or whether they're using computer navigation to align the parts. I've done them all and compared our instruments to these newer techniques, and our instruments outperform them every time in surgery. Where when I do our cuts with our standard instrumentation, it's perfect 95% of the time where I don't have to tinker around with the parts. Mm-hmm. These newer things, I try them and I have to tinker a little more.